Autism is a complex condition. It affects around 3% of children. And problem with autism is, if left untreated, child may be unable to live independently in future life. That's the main problem with autism. That's why early diagnosis is important, early intervention is important, but autism generally is diagnosed at the age of 5. But many symptoms and signs occur before the age of 2. That's why we will discuss most important and earliest 7 signs and symptoms of autism. What is autism? Simple definition. It's when children have problems with communication, repetitive behaviors, and sensory sensitivities. First sign of autism is social challenges. For example, child does not respond to their name at the age of 9 months. When mother is calling, he or she does not respond. That's first sign of autism at the age of 9 months. Another sign is they don't respond games like peek-a-boo, for example, and also they avoid eye contact. They are very important milestones at the age of 9 months. That's why it's considered strong indicator of autism if they does not respond their name at 9 months. Second is lack of social smile. When mother is smiling and when mother is joyful and kid does not respond with smile at the age of 6 months, it's considered lack of social smile, and it's also considered as an important determinant of autism. It's very important part of development, social development of kid. 3 is delayed babbling, such as saying dada or baba. This babbling also important milestone at the age of 9 months, and if there is delayed, of course it's possible people and kids who speak late, they can have some delayed babbling, but it can be important sign of autism also. And 4 is unable to pointing something at the age of 12 months. For example, kid wants some toy and does not point, or does not point something, or does not follow something. It's considered important milestone also. If they don't point, it means increased risk of autism. And 5th is hand flapping. It's very important repetitive behavior. They are doing like this, and this flapping is it can be expression of themselves. It can be soothing mechanism for their excitement or for their sensory sensitivities. It can be their soothing mechanism, and it can be sign of autism. But other children also sometimes flapping hands, but if it's not contextual, it is contextually inappropriate, and if it's frequently, it can be sign of autism. And 6 is rocking. Rocking means when child moves their body back and forth while sitting, for example, or while on his knee or on his hands. They are rocking back and forth, and it is soothing mechanism also. In other kids also common rocking, but if it's contextually inappropriate and very common, it can be sign of autism. And 7 is spinning objects or watching spinning objects. And many kids are fascinating if they're watching something is spinning, but if they are focused and fixed on this spinning objects, it can be sign of autism. And 8 is meltdown. Meltdown is not tantrum. Meltdown looks like tantrums. For example, it can be sensory overload from noise, and child becomes overwhelmed and have meltdown and unable to console or calm, but it's not tantrum. Tantrum has a goal. For example, kid wants a toy, kid wants a sweet, but in case of meltdown, child is unable to manage his or her emotions and meltdown, and it's very difficult to soothe kid at this case with typical soothing strategies. It's meltdown, and meltdown requires more attention, more patience, because even kid is unable to calm himself or herself. That's why meltdown is not typical tantrum. That's all I wanted to say. That's early signs of autism, which any parent can watch, and it's important to spot autism at its early stages, because a child's neuroplasticity developing at the earliest stages more rapidly, and it's important and easier to change kids' neuroplasticity at earlier. That's why spotting autism at earliest is important and effective. Thank you for your interest. Thank you for watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.